1.
Okay, so now we're going to go over the method we're going to use to measure lumbar flexion and extension, okay, objectively measure. So to do that, we need to make some marks with a erasable marker on our patient. The first thing we're going to do is find S2 and make a mark on S2. All right, so to do that, I'm going to kneel behind my patient and palpate for her PSISs, okay? Once I find PSISs, if I go directly midline from there, I'm going to be on the superior part of the sacrum, and I can count down to S2. Once I find that, I'm going to make a small mark right there. Okay, second mark is going to be 15 centimeters superior to that, so I'm going to have my tape measure handy, and I'm going to measure this with my patient standing in neutral. So I'm going to find my first mark, as you guys can see, and move up. Is it okay if I roll your brow up a little bit? Thank you. 15 centimeters. Okay. So that is 15 centimeters. I make my second mark there. So now she has two marks 15 centimeters apart. All right, so to measure, I'm going to use an inclinometer. And I need to take two measurements with the inclinometer when she goes into flexion or into extension, okay? And I'm gonna have her turn the side on so you guys can see that. Two measurements will be in each of flexion and extension. I need to measure how far the sacrum moves and how far the superior portion moves, and then I'll subtract. The difference is how far she flexes. Okay, so now I'm going to begin to take my measurements. I'm going to use this inclinometer here. I have to zero it out once I place it against her sacrum. So I'm going to place it with the white dot directly over the mark that I made and hold it in place with one hand. Once I've done that, I'm not touching the dial except to zero it out, which it is now. And then I will keep it in place without moving her. I'm going to ask Megan, can you bend forward for me and flex all the way down? And then I'll take my first measurement, which is an 82. I'm sorry, a 78. Come on back up. And then I'll repeat that procedure at the top mark. So I'll place it over the top mark, re-zero, and then hold it a little more securely this time. Can you slowly bend forward for me? There we go. And now I've got 140. So I would subtract 78 from 140, giving me the amount of flexion that she has. Okay. Okay, so now we're going to repeat that procedure to measure lumbar extension. Okay, we're going to use the same marks we previously used, and we're also going to use the inclinometer again. So I have Megan standing neutral. I replace over the sacral marking and re-zero my inclinometer, and then I ask her to place her hands on her hips. And Megan, can you arch back for me? Okay, and she gets 10 degrees here. Okay, now I'll take my second measurement. I'll replace it over the superior marking, re-zero at that marking, and then ask her to move and arch her back again for me, please. And we've got 55. Now I subtract the 10 from 55, giving me 45 degrees of lumbar extension.